Hi, everyone, and welcome to SCAN's Lunch and Learn today. I'm Mary Beth Kwapniewski. I am the program director here at SCAN, which stands for Senior Citizens Activities Network. And for those of you joining us for the first time, SCAN is a nonprofit serving seniors in the Monmouth and Ocean County communities, and we have been keeping seniors active, healthy, and connected since 1988. Our physical location is here at the Monmouth Mall. So we have two great presentations set up for you today, and I'm going to introduce our first presenter today, who is Heather Sanchez with Care One in Holmdel. So good afternoon to Heather.
Hello, everyone.
Hi, Heather. How are you?
I'm well, thank you. How are you?
I'm good. Thank you for being with us today. So if you would like, why don't you tell us a little bit about what you do for Care One and Care One's role in the community as a rehabilitation facility.
So my name is Heather Sanchez. I'm the Director of Marketing for Care One at Holmdel. And just to give you a little history about Care One is a family-owned company. They have about 34 facilities across the state of New Jersey. Care One Holmdel, which is where I'm located, has offered a variety of different services for post-acute care, which is after their hospitalization, going to the next step after discharge for physical therapy, IV infusion, wound care, but we'll go more into that later. I wanted to discuss some of the options that people have when they're being discharged from the hospital. So as far as when you're in the hospital and you have the case manager comes in and she'll give you options, whether it be home care versus post-acute care versus acute rehab. So there's a lot of different variants that they offer. And it can be a little overwhelming at times. So one of the things that we try to educate and really inform the community is that you have a choice on what you want to do, and you also can do a lot of research, and there's a lot of things available. Medicare.gov, you can actually put up to 3 different facilities on Medicare.gov, and it'll show you their star ratings. It'll show you staff first patient ratio. It's very informative, but a lot of people don't know that unless it's told to them. So many of the case managers have started to do that within the past 2 years. And that's something that Care One does as well. Depending upon the patient's medical stability really will determine what is the next step for them. The physicians will evaluate them, whether they need to go to a rehab at all, or if they could go home with physical therapy, because that's always an option. And you'll get a list. Many of the hospitals now provide a site called CarePort, and they actually will send you a link that has, it goes in from they do like a 20-mile radius of whether it be your family or loved ones, home zip code, or your own, depending upon what you are looking for. And it goes into star rating, and you actually get to pick up to 5 different facilities. And then those facilities will receive your medical information and evaluate and see if you're an appropriate candidate for their location. So that would be when you need post-acute rehab, like Care One. So for example, if you needed to continue IV infusion, but you also had wounds that needed to be treated. These facilities, post-acute facilities like Care One, we provide wound care, but we also have wound care nurses that are certified and physicians that come to the facility. We also have EKG machines, we have bladder scans, a lot of different things that the community may not always relate to these types of facilities. So a lot of the times we'll see that patients don't really know what's available to them in these facilities. So it's always good to ask the social workers any questions, or to call the facility yourself, or have your loved one tour them. Right now at Care One, we are currently doing bedside blood transfusions. So just to give you like a clinical background, there's so many different options that you have prior to going, home if you need it. But again, you can always do the, you may be able to just go straight home. A lot of the times the ortho patients just require from hip surgery to go directly home, and, they can do outpatient physical therapy. So it just really depends on your stability. If you have a loved one, a husband or a wife, or you're the primary caretaker, and maybe they think that you are capable of taking this patient home, sometimes you get home and you decide that it's overwhelming, it's too much. You can also go directly from home to a center. I know Care One, we will provide transportation, we will evaluate the medical information, and it's available 24/7, 7 days a week for the skilled nursing care. So there's just a lot of different options that are out there, but unless you ask questions, or unless you do the research, you're not going to know. So the best thing that I can suggest is definitely asking questions, and also doing the research and touring the facilities and reaching out to them. Call the facilities. That's always an option, because a lot of the times we hear, well, they said that I had to, that this facility had a bed, or I had to go home because my insurance was Medicare and I only stayed 2 nights. Well, there's a waiver in place now that some facilities will utilize. During the pandemic, they created a waiver that you do not require 2 nights in the hospital. So that's another option. So there's just many different variants that are out there. And it's very important to ask the questions, and feel confident to, feel confident enough to inquire with your case manager or your physician what my options are if I'm going to be discharged from the hospital. Any questions?
I'm coming on video. So Heather, one of the things that we were talking about yesterday, and I'll come up, hold on, I just want to do this. Yesterday, we were talking about making sure that people are educated before they're in a situation where they get sick, right? Because sometimes you're scrambling, trying to find out information. So I think that's what you were suggesting in terms of educating yourself in advance, because are some subacute facilities known for a specialty, whether it's cardio, vascular disease, or pulmonary?
Yes. Many of the Care Ones do a variety of different things. And then many facilities have a specialty, like you said. Not every facility has a respiratory therapist on site for a pulmonary program. So yes, that's correct. There's many different variants. Not every facility has a cardiologist that comes on site. Not every facility has a neuro. So there are many different options out there in different programs. So for example, we just kicked off a Parkinson's program, the LSVT. Now, this is brand new for our facility, but there are other facilities that were doing it prior. But Care One, really, we started to kick this off here at Homedale, and hopefully it'll spread, all over to other facilities as well, because it really is a great program. And unless you have Parkinson's for many years, you may not be familiar with the program. So there's just a lot of information out there. So it's important to, like you said, inquire, ask questions prior to hospitalization, or whether it be just for your diagnosis. If you just want to know what options you will have for the future.
Right. You want to be prepared before you get in that crisis mode, and whether it's you or our loved one. And again, if anyone has any questions, please feel free to put it in the chat feature of the webinar. I forgot to mention that earlier. And Heather, what is the time frame that Medicare covers when someone's in rehab? Is there a certain number of days when you're in rehab?
Yes. So Medicare covers 100 days, but days 1 through 20, it covers at 100%. And then starting from day 21 to day 100, there is a standard rate copay. I believe it's up to $186.74 a day. Now, depending upon what your secondary is, many of the secondaries cover that percentage, that 20%. So, that's another thing you want to find out what your coverage is, whether it be Medicare or your HMO. And you can call the facilities and just give them your information and they'll pull it right up for you.
And they'll tell you if they're participating with that coverage. Okay.
Right.
Perfect. Okay. If there are any other questions that are out there for Heather? So Heather, your best advice is to make sure you're prepared. And as I shared with Heather yesterday, I had a family member who took ill a couple of years ago. And I was very thankful that from my job here at SCAN, I've learned about the different options that are available when someone takes sick. So I felt confident when I had to make a decision as to what to do when the family member was discharged, that I didn't feel like I was scrambling. So definitely take Heather's advice. Do some research in advance, know what's available around the areas that you live or your other family members. Because remember, if they're going to come and visit you, you want to make it convenient for your family member as well, because you want to see them visiting you. Okay. Well, I thank you, Heather, for your time today. And if anyone has any follow-up questions for Heather after today, her contact information will be up on the slide at the end of our virtual Lunch and Learn. So thank you again, Heather, for being with us today from Care One Homedale. Have a good day, Heather. Thank you. Okay, so a nice tie-in is we have Marlo from Brave and Health joining us next to talk about our Medicare 101. It's open enrollment season. So hello, Marlo. Hi, good to see you.
Hi, everyone. Yes, my name is Marlo Seppin, and I've been working in the health insurance industry for over 25 years, probably closer to 30 at this point. But the last couple of years, I've been in the government programs division and specifically in Medicare. So, and I'm also a licensed agent for the state of for Brave and Help. So I'm delighted to be here with you today to go over the building blocks of Medicare.
Great. And I know Marlo has a wonderful presentation that she put together for us. So let me pull that up. Okay, we can all see that, right? Marlo, can you see it?
Yep.
Okay, perfect. So you just tell me when you want me to advance and.
Yeah, I'll say next.
Okay.
That'll be fine. So Medicare can be,
sorry. And then, got it. Go ahead.
It's okay. Medicare is extremely complicated, and to help make it clearer, we put together this presentation to help break it down. The first thing that we're going to go over are Medicare basics, how much, what it covers, how much it costs. This is, again, the 30,000 foot level. This is not in-depth benefits of any sort. Then we're going to go into the enrollment periods. Then we'll dive into each of the blocks of Medicare, A, B, C, D. You hear all of those, throughout these commercials that are on at this time of year, and supplement plans. And then lastly, we'll review what to go over when choosing a plan. Now, I'm old school. I keep my notes with me all the time. They're old. I always have them because I don't want to miss something. It's really important and it's pretty detailed. So let's go to the next slide. All right. Before we get started on this slide, I want you to know that before you go into Medicare, most people receive their healthcare coverage through your employer. The employer picks the plan, the benefit plans that you can choose from. Maybe there's an option, maybe there isn't. They help administer the plan. They pay for the majority of the cost of the plan. When you go to retire, that responsibility becomes yours. So today we're going to help you understand what those selections are and what is, the best plan to help meet your individual needs, guide you in that direction. Medicare benefits are different than group coverage, so that people are most familiar with. I'm going to pose a question, and if you can get an answer, Mary Beth, maybe they'll type it into the chat. Does
Okay.
anyone know what year Medicare was introduced?
And I'm going to be honest with you that I can't see that one tab at the bottom that shows me my chat, and I don't know why. Oh, there it is. Okay. What year was Medicare introduced? I'm not seeing any answers at the moment.
All right, so in July of 1965, Congress enacted Medicare under the Title 18 Social Security Act to help provide health insurance to people age 65 and older, regardless of their income and their medical history. So if we were together, I would have posed that question, given somebody a small prize, but we're at this time. So maybe if you hear this again next year, we can do that.
Okay.
It's a federal program that provides inpatient and outpatient medical coverage to inpatient and outpatient medical coverage, which we're going to talk a little bit more about. It is not Medicaid. Medicare and Medicaid are not one and the same. One is income-based and run primarily by individual states, and the other is based on your age and run by the federal government, and that's Medicare. So somebody might ask themselves, can I have Medicare and Medicaid? Anybody know the answer to that?
I want to say the answer is no, but
No, you can have, yes.
can have.
Yes, they are two separate programs and you can have that. All right, so let's review the points on the slide. Medicare is a federal program that provides health care for the aged and disabled. Okay, it includes inpatient and outpatient medical coverage, and Medicare is federal based on age, and Medicaid is income, and it's based mostly and run by the state. Okay, next slide.
It's not advancing. Hold on, I don't know why it's not going. All right, sorry, Marlo. I'm not sure why it's not moving. There we go. Wait, did I go too far? Is that the
Yeah,
next
no,
one?
you're good.
Okay.
Nope, that's it. All right. What do I need to do? Everyone has a unique situation and tolerance, so your Medicare selection is your own. Your decision needs to be based upon your lifestyle, your health, your age, and your needs. If you were working and you had like a family coverage, or you had a husband and wife coverage, or a spouse coverage, you were together in that group plan where you worked, okay? Now you are an individual. So everyone is different. So what are the things that you need to do? You need to sign up for Medicare Part A, sign up for Medicare Part B, understand what your Medicare choices are, and then select a plan that best fits you. Okay, and again, that's based on your lifestyle, your health, your age, your work status. And we'll go to the next slide. Again, what if I'm still working? You may be able to defer signing up for Medicare if you're still working. Okay, talk to your employer, your union group benefit administrator, to see whether or not they require you to sign up for Medicare. And if your employer doesn't require you to sign up for Medicare right away, then you don't need to do anything until you retire or lose your coverage. Okay. All right, next slide. All right, the enrollment periods. When can you enroll? Now, this is your initial enrollment period, and this one gives you a visual of when you first become 65. All right, You need to take action to enroll in your Part B. All right. So you have the 3 months before your birthday month, and you have 3 months after to enroll. Okay. So in most cases, if you don't sign up for Medicare Part B in this initial enrollment period, you're going to have a late enrollment penalty. This penalty will stay with you for as long as you have your Part B. If you pay into the Medicare system 40 quarters, you'll be automatically enrolled into free Part A. So I guess that's equivalent to about 10 years worth of work, but that's 40 quarters and you can get it free, your Part A, which is your hospital, and we'll go into that. Otherwise, you can enroll into it, but there's a cost associated with it. So this is your typical window of opportunity for what is called the initial enrollment period. Next slide. All right. 2 other enrollment periods are your special enrollment period and your general enrollment period. Your special enrollment period is event-based. Okay. So for certain quality of life events, you lose coverage, you retire, you're losing your group benefits, you retire after turning 65. That could be a special enrollment period. Then there's the general enrollment period. If you didn't sign up during your initial enrollment period and you don't qualify for a special enrollment period, there's always a time of year called a general enrollment period. And that starts January 1st of every year and it goes to March 31st. However, your coverage will not become effective until July 1st. And you may have to pay a higher Part A, Part B, or Part D premium for being late, for having a late enrollment. It's called a late enrollment penalty. Does anybody know why that they would impose that on us?
I don't know.
Anybody in the chat?
I don't see anybody responding to the question in chat.
Okay, you're all supposed to get in the beginning. Okay, so whether you're working after you retire, that's when you should sign up. But if you don't, they delay it, because when would somebody look to sign up past any one of these initial enrollment periods or special election periods? They'd wait until they were sick. Okay, and then they're not paying into it as else is. So they give you a late enrollment date and penalties, and they delay it till 7/1. So it's best to, learn about these things, go on to Medicare.gov and speak with an agent, and if you're still working, speak with your benefits administrator. Okay. All right, let's go on to the next slide. All right, good visual here. These are our ABCs. Knowing all the parts of it. Part A is your hospital coverage. Part B is your doctor coverage. Part B, I know I'm skipping a letter, is your prescription drug coverage. Then there's Part C, which is Medicare Advantage. And then there's your Medicare supplement. Okay, so let's go to the next slide. All right. Here's your beginning. Here's your Part A hospital coverage. We've talked about the blocks. Let's dive into what is known as original Medicare, Parts A and Part B. Medicare, again, is a federal health care program that provides your hospital and medical benefits. This up top here is the John Smith red, white, and blue card that you'll receive when you first enroll in Medicare. It indicates what your effective dates are. Okay, which may be different. Sometimes Part A and Part B are different depending upon your situation. Usually you have to pay into Part A over your working years, and it could be automatically enrolled in that once you start receiving your Social Security benefits. Again, I said it's about 10 years or 40 quarters paying into the Medicare system in order to have no cost for that Part A hospital coverage. There are exceptions for people who didn't work long enough, and you can purchase Part A with a premium. Okay. Part B almost always has a premium associated with it, but it's based on your income. So some people may pay more or less than the typical standard premium. This year at 2021, it is $148.50. I don't have on Medicare.gov what the 2022 is going to be. Part A, hospital coverage. We're not going to get into a lot of detail here. And then there is Part B, which is the driving factor for a couple of different things in order to purchase additional coverage, like a Medicare Advantage plan or a Medicare supplement plan. Okay. So let's go into some bullet points here. Okay. Part A, hospital coverage. That is your hospital services, inpatient care at a skilled nursing facility, inpatient rehabilitation, home health care, hospice care. Okay, and we had Care One speaking just before me, so that's your inpatient at a skilled nursing facility. All right, and then there's Part B, the doctor coverage, doctor visits, outpatient treatment, preventative care services, durable medical equipment, ambulance services, and mental health services. Now, before we go on, I wanted to go into what the skilled nursing facility, since we just talked about that. Again, you have to be discharged from the hospital to go into inpatient rehabilitation. And then let me go over a note on home health care. Home health care is not to be confused with long-term care. Both deliver in-home care, but home health care includes specific services like administering medications or wound care, where the difference in long-term care includes assistance with the activities of daily living, such as bathing, toileting. Those things are not covered by Medicare, so it's important to know this, okay? Hospice is always covered directly by your Part A, even if you're in a Medicare Advantage plan. Let's see, Part B, outpatient preventative care, durable medical, ambulance, mental health services. It's also, there are limited medications that are covered under Part B, like chemotherapy, immunosuppressants, and anti-rejection drugs. So I just want to mention that as well. Next slide. Okay, this kind of looks very familiar. If you have been watching TV, other than the elections, you'll be seeing at this time of year from October 15th to December 7th, commercials about Medicare. This is what's called your open enrollment period. And you'll see that original Medicare only covers typically about 80% of your medical expenses. Okay, so there are advertising to you that, you know, if you have your Part A and your Part B, it may not be enough. Okay, so some things to know there. There's also some Part A deductibles that you have. And so the current Part A deductible for the plan year is $1,484. So that's inpatient at the hospital. So there are things, and that 20% that you would be responsible for, there's no ceiling to that. So it is important that you understand the next couple of slides that come up. So let's go into and dive into that. All right. So what is a Medicare supplement plan? It's also known, or you could have known it or heard somebody speak of Medigap. Same thing. You can go to any doctor or hospital in the country who accepts Medicare. In addition to your Part B premium, you'll pay a monthly premium, and the plans are standardized, okay? So when you go into a supplement plan, it's best to shop the carriers, whether it be Braven, Horizon, any United, any of the other ones, you want to go in and shop the plans because it's based on age and they're all standardized from the government. However, they all have different premiums and underwriting that has to happen. Okay. So you want to make sure that if you're purchasing a supplement plan, that you look at all of those factors. All right, let's go into the next slide. All right, so what does it do? Let's go to these points. So you'd have your Part A, your Part B, and then you would add your supplement, okay? Part A and Part B have deductibles. I spoke about that. You have your Part B deductible, your Part A deductible. You'll have co-pays, co-insurance, okay? But the supplement plans can help pay for those things. They can help cover, depending upon which letter plan that you choose, and an agent is very helpful in going over your situation and help you decide what is within your budget to cover. So it'll help cover Part A, Part B, your co-payments, your co-insurance, provider excess charges. Provider excess charges are when you go to a non-participating non-participating provider. Now, those are kind of hard to find. However, they can charge over 15%. I mean, 15% above and beyond what Medicare allows for a service. So those excess charges, instead of being incurred by you, you can get a supplement plan to cover provider excess charges. Blood transfusion, foreign travel emergencies, and any additional hospital days. All right, let's go to the next slide.
Why my screen once in a while is freezing up. Okay.
That's okay. Prescription drugs. Let's go to Part D. Prescription drug plans are only offered by private companies, not the government. The plans differ based upon where you live. Drugs are typically listed in a formulary with 5 tiers. Sometimes this year there might be a 6th tier, and you can also incur a late enrollment penalty if you don't get in during your initial enrollment period. That late enrollment penalty will follow you throughout your stint with Medicare. So if you decide not to purchase a standalone Medicare Part D or a Medicare plan that includes the Part D coverage when you first become of age and eligible for your initial enrollment period, you may have to pay that late enrollment penalty. Now, again, people who turn 65 are sometimes not on any medications. Some people 75, 85, and then all of a sudden your doctor puts you on something. Oh, well, I don't have coverage for that. Now I need to buy a Part D. You didn't have any coverage within that first couple of years. They're going to charge you a late enrollment penalty, and that'll follow you for the rest of your days. Okay, next slide. All right, let's see how it stacks up. This is the first option that you can do. You can buy it separately, okay? You would have your Part A, Part B, okay? You would pay your premium for Part B. That'll come out of your Social Security. What was it, $148.50 this year? Then you would pay your supplement, and then you would pay for a drug plan, okay? That can get pretty costly, and it's in pieces, but it would cover you all the way through. You would have your hospital coverage, you would have your doctor coverage, you would have your supplement to take care of that 20%, and then you would have your drugs covered. So that's a good thing. All right.
Next one, Marla. Yep.
Okay. Then you can go to, or I should say, you can go to Understanding Medicare Part C. Part C is called Medicare Advantage. It includes all of Medicare Part A and Part B benefits. So anybody who offers a Medicare Advantage plan, all of what's included in Medicare Parts A and Part B have to be in that, okay? And they have to be approved by the Centers for Medicare and Medicaid Services before offering that plan out to the public, okay? It may offer a prescription drug coverage and additional services. When you hear all of those things on the television, hearing benefits, vision benefits, dental benefits, okay? Those are programs that are not offered by original Medicare. So those are extras that could be included in your Medicare Advantage plan. What could happen though? You have to use a specific network of doctors and hospitals. And it also may require you to pay premiums, co-payments, co-insurance, deductible, and other out-of-pocket expenses. Okay, next slide. So that is your second option. Your second option can be a Medicare Advantage plan by itself or a Medicare Advantage plan with a prescription. Now, why would they offer Medicare Advantage without the prescription built in if they're calling it an all-in-one plan? Because some people could get their drug coverage in a different avenue, like the VA, if they're a veteran. So you might be able to pick up a Medicare Advantage plan that way that doesn't have the prescription drug coverage in it. Okay. So let's go over what does it all cost. Part A is free for most people as long as you are already receiving benefits from Social Security. Part B requires you to pay a monthly premium, which can change from year to year, usually going up. Medicare Part C Advantage plans, costs vary by the plan. A lot of times you'll see though that they're out there that are zero, where the insurance carrier gets paid enough money to administer that Medicare Advantage plan on behalf of them, okay? Because remember, it has to be approved by the Centers for Medicare and Medicaid Services, that they don't have to charge you a premium. So that's why you'll see a lot of the advertisements for a zero premium plan. But some of them do have some costs associated and premiums available. I mean, some with premiums. So you can shop those around. And again, every year you get the opportunity to look at that from October 15th to December 7th. If you make a choice or a change, that will become effective the first of the following year. Part D, prescription drug plans, those costs vary by plan, and so do Medicare supplement plans. So you have to look at each company. Again, you can do that on medicare.gov. You can go in, type in your zip code, and you can go and look over all the plans. And there's some comparison tools in there as well. Next slide, I'm sorry. What to consider. Cost. Cost is always a big thing to consider. How much am I going to pay out of pocket? You do know that when you have your first option, when you're stacking all the blocks with a supplement, you're going to be paying those premiums for that supplement up front and then probably have a little bit of cost out of pocket. Advantage plans, you pay more. You could have a lesser of a premium, but you might be paying them in co-pays for specialist visits, doctor visits, and so on. So there's two different schools of thought on how to do it, but you have to go through and consider, how many times do I go to the doctor a year? How many specialists do I see? Do I foresee being inpatient, or am I planning a surgery? Those types of things you have to consider. Benefits. Does the plan offer extra benefits beyond original Medicare? Some people really like the extras that come with an Advantage plan, the hearing, the vision, the dental, all of that. Those are very attractive to a lot of people. Prescription drug benefits. Prescription drug benefits, are they included in the plan? Or if I'm going with a supplement, do I have to buy one? And if you're going in any plan, you need to shop for the ones that cover your specific medications. You can always do that again on medicare.gov. You can go in and shop the plans that are available to you, or the Medicare Advantage plans that have your specific medications. And you can put that in drug by drug. And then the other thing is travel. Do you spend time in another state? Do you need a larger network to cover you? Okay, that's another really big thing to consider. There's the terminology of a snowbird. Sometimes we have people who go to other states and they would like to receive care when they're out of state. So that's another thing to consider. And I think that the last slide. Oh, top three things. Again, original Medicare covers some basic medical expenses, but not all of them. Original Medicare does not cover most prescription drugs. Remember, it was chemo, immunosuppressants, and injection drugs. So that's the ones that they do cover, but they don't cover the regular hypertension drugs, so to speak. And then you have a choice of plans that can help you fill in the gaps in your coverage. So definitely take a look at your plan to see that it is covering you from year to year. Then this is the time of year to do that. Are there any questions?
I'm taking a look in the chat. So Medicare.gov, ultimately, Marlo, is really your best resource for doing all your comparisons.
You know, that or an agent, you know,
Okay.
Agent will do, you know, ethically, they have to do right by you. So if you bring your list of doctors and your list of drugs that you're currently taking, and, you know, anything that you may knowingly foresee, then bring that to them and they will guide you and, you know, show you what your options are and include the costs.
Okay. Okay. Because your prescriptions and the doctors and your specialists, those all really do play a key role in making your decisions.
Absolutely. Absolutely. And there's a lot of different Medicare Advantage plans out there that have HMO networks, which are a health maintenance organization networks. They tend to be a little bit smaller. Then there's the preferred provider organizations. Those are usually a little bit bigger. And then there's ones that cover many states. So again, those are things that you need to take into consideration if you're going to be looking at a network of doctors. But you always want to find your primaries, your specialists, and your drugs.
Right, right. It can feel very overwhelming.
Yes. Yes.
Take your time. Take your time. You don't make these decisions quickly. That's for sure.
Right, right. And you know, the plans sometimes change. You know, if you're in a certain Medicare Advantage plan, they may change the benefits a little bit. So you want to check and get an update every year. So check with the current company that you're with and see if there's any updates that may adversely affect you. Then open that up to shopping again.
Right, right. Good point. Good point. Well, I thank you, Marlo, for being with us today. And this was recorded. So if anyone needs to rewatch this presentation to absorb it some more, it will be available next week for viewing. And I'm going to share a slide at the end with Marlo's contact information and Heather's contact information if anyone has any questions that they think about after today's presentation. So thank you again, Marlo, for being with us. And I just wanted to remind everyone that next Thursday at 11:30, we are hosting a Meet the Physicians with Monmouth Medical Center, and registration is open up on SCAN's website under free public events. So I thank everyone for joining us today, and I will put up everyone's contact information. Just bear with me a second. Okay, there we go. All right, have a great day, everyone. Thanks again, Marlo.
Thank you.